we can simply define the smile design that has been more popular nowadays and is demanded by more people related to the aesthetic concerns as the changes on the teeth in order to enhance the appearance of the smile, which helps us make the people happier when they see themselves in the mirror. We use various materials while designing a new smile. The objective can be whiter or more natural-looking teeth, and there are also patients who want all the teeth to be identical, including the ones being invisible whilst smiling. Depending on the patient's smile goals, the correct material is chosen. The amount of tooth shaving is parallel to the aesthetic expectation. If the patient does not complain about the color of his teeth and want major color changes, with a minimal preparation, the shape of the smile can be advanced. On the other hand, there are misunderstandings about veneers. It would not be correct if we said that no preparation is necessary. If veneers will be applied on teeth on the upper and 10 teeth on the lower jaw, the width of the aesthetic material to be placed has to be considered while the tooth is trimmed. The other type of veneers discussed on some social media platforms, which does not require any preparation, do not give the desired outcome. When we use non-prep materials, it's very likely that the tooth will look bulkier and less elegant, as it will be larger than its original size. In extreme cases, when a tooth is positioned inwards, there's a probability that a veneer can be used without a preparation, whereas this will not be possible when it comes to a full set. Furthermore, we do not recommend the application of dental veneers on posterior molars, since they do not resist the excessive biting forces, which will increase the chances of complications even in short term, leading to dissatisfaction. Zirconia is our secondary recommendation to the patients who lost a part of the tooth tissue, have decayed or missing teeth or fillings. We can reveal that zirconia is the only material which looks natural and has mechanical resistance against damages and can reach very bright tones independent from the color of the natural tooth to be covered. Zirconia is a satisfying product both as material and aesthetics. The tooth will have to be grinded down by approximately 1 mm from the surface, each direction, to make space for the dental crowns. The third option, E.Max, known for its aesthetics, is made from lithium disilicate material or glassy ceramics. Despite its superior aesthetic advantages, an extremely white result will not be possible with E.Max since it reflects the color of the original tooth underneath. The making of dental bridges with E.Max increases the complication risk. With the application of E.Max porcelain crowns on the natural teeth, a very aesthetic outcome is achieved. However, if the patient has a discolored tooth on the smile line due to root canal treatments, etc., the color of the crown will probably not be identical to the others. And even though different types of adhesives or opacers are used, this may not be sufficient to match the color perfectly. In such cases, we more likely recommend zirconium porcelain crowns. The last option is metal-fused porcelain, which has been used for years all over the world without notable problems and possesses high mechanical strength. This material is most used for the patients having more than one missing tooth in a row to increase the strength level of a dental bridge. Compared to the other materials metal-fused, porcelain is not one of the most aesthetically pleasing materials, but on the other hand, not only can we use it in the anterior part, but also in the posterior part of the mouth. The metal inside is not visible since it is covered with the porcelain on the surface. However, the reflection of the metal can be noticed by a specialist. We can sort our aesthetic preferences as zirconia, E.Max, veneer, and metal-fused porcelain, respectively.